In early February, a man tested positive for COVID-19 after disembarking from this ship, the Diamond Princess. The ship was quarantined immediately after arriving in Japanese waters a few days later. More than 3,700 passengers and crew members were on board. 700 people on board soon sickened with the virus. For weeks, the ship was the site of the largest outbreak outside China. 5 months later, cruise ship operators are pushing to reopen. But can they guarantee passenger safety during a global pandemic? Big question. Welcome to your COVID-19 special on DW News. I'm Monica Jones in Berlin. As always, so very good to have you with us. Now, for millions of people, cruise ships meant one thing: the holiday of a lifetime. Now, that was before COVID-19. Now, operators want a fast reboot. But after outbreaks, like aboard the Diamond Princess, DW's Ben Fasulin wants to know if anyone will ever want to take a cruise again.
Most of these big boats aren't going anywhere. I was never a fan. 2016 was my first and last cruise. I caught the norovirus and was sick as a dog.
Ever since then, I've kept my distance. This is as close as I'll get to the giants of the sea, Hamburg, Germany's main port. But I am one of the few. Despite health scares and the sector's huge carbon footprint, business had been booming until the coronavirus.
Now operators face billions in losses and lawsuits. Health experts say the ships helped spread the virus. The industry says it took extraordinary measures to limit outbreaks. Germany's Artania had to call on Australia for help when the virus broke out. This cruise entertainer was trapped aboard and is critical about one thing.
The ships don't have a laboratory to carry out corona tests or the like. That has to be done on land and takes time.
Will passengers want to take a cruise again?
Definitely. We're booked out. Our passengers all want to come back. We're booked out for the next 2 years, and I'm certain many, many people will want to do the trip.
It'd take a lot to convince me to set sail again, but I've got nothing against this little guy.
And I've got Walter Krombach to hold my hand. He's an expert in the field.
Are cruise ships more susceptible to something like the coronavirus than other places?
Yeah, certainly they are, because wherever you have big crowds of people, 4,000 up to 6,000 plus the crew on a narrow area together, mixed together, the risk is there.
So basically these giants of the seas, some of which have only just been finished, but are they going to ever run at full capacity?
There was a very big demand, and this was the reason why more and more ships of this size were being built. They really thought, everybody thought, obviously in that business, that it will continue continuously. And Corona made a stop, a full stop.
Some smaller expedition boats are now allowed back to sea, but with only half the passengers and no stops along the way. The big ones are still in dock.
They look so alone, completely empty. But bookings are already surging. Operators are offering big discounts and promises of a gold standard in public health. Some analysts expect another boom, even bigger than before the crisis. Just don't count on me.
And for more, I'm joined by Professor Alexis Papathanasis. He's the chairman of the Cruise Research Society and co-director of the Institute for Maritime Tourism at Bremerhaven University of Applied Sciences. Now, that out of the way, good to have you with us. First question simply has to be, would you board a cruise ship right now?
Me personally, I would probably do this, but mostly for research purposes.
All right. So you probably would wear your mask and not look for fun. The problem is, why did cruise ships get caught up in this pandemic in the first place, more so than aviation or other modes of transport? What went wrong?
Well, I think to a certain degree, it's very easy to trace back, let's say, a corona outbreak on a ship rather than on an airplane. Simply because, you know, in an airplane, people go in and out, and it's very difficult to trace back where it came from. Plus, cruise companies were deployed in Asia, and where the outbreak started. And therefore it caught the news. And I think this is basically what happened. I don't think that Aviation is less risky than a cruise for that matter. But as I mentioned, it's very, very difficult to trace back to where the people got it. I mean, if it shows up in a cruise, they know it was on a cruise. Or it doesn't really matter whether it was on a cruise, but the cruise gets targeted for it.
Right.
But if it's on an airplane, it's very difficult to trace back to it.
And of course, on a cruise ship, you spend so much more time. So if there's a case detected, then you're stuck with it. And of course, you mentioned risk. I mean, the typical cruise ship client is middle-aged or older. And knowing that this is the high-risk group, what advice do you give them?
Well, I would, at this point of time, I would avoid. Normally, the average age for a cruiser is around about 47. So I think there's a big span of what we would call middle age. But if we are talking about people, high-risk people that have previous illnesses, I would, at this point, advise them to not join the cruise. In the same way, I would advise them to restrict their traveling as much as possible.
So would you say that those cruise ship operators have learned their lesson to make it safe?
Well, I don't. It's not like they've been trying to keep it safe, and they had outbreaks in the past. The big issue is how do you deal with a crisis when such occurs? And the communication has been a bit poor. Plus, I'm afraid they're currently trying to really start up as quickly as possible. This is the focus. Whereas I think they should be trying to really carefully redesign, test, and train their personnel for the new situation. Because if something goes wrong in the current situation, it's going to escalate in the media, and the industry cannot afford more negative press than they already have.
Indeed. So fingers crossed. Hopefully it'll all work out all right. Alexis Papadanasis from the Institute for Maritime Tourism in Bremerhaven. Thank you so much for your time, and do stay healthy.
Thank you very much. The same to you.
And now, for the last time this week, we've got our science correspondent Derek Williams answering your questions. And this week, you wanted to know about T-cell immunity.
What is currently known about T-cell immunity?
The immune system is quite complex. When the body is infected with a virus, it mounts an immune response. In it, what are called antigen-presenting cells ingest proteins from the virus and display them on their surface. This activates T helper cells, which initiate a host of immune functions. One is to help activate what are known as cytotoxic or killer T cells to destroy cells in the body that are already infected. And they also stimulate so-called B cells to produce antibodies that bind to the virus. The antibodies prevent a virus from infecting other cells and tag it for elimination. And antibody levels are what we focus on when we think about how long immunity lasts. But what are called memory T and B cells also play big roles in the immune system's long-term remembrance of specific pathogens and quick response if you're infected again. Research into and debate on T-cell immunity is ongoing, but it appears that even in recovered COVID-19 patients whose antibody levels later drop, T-cells continue to provide some protection against getting the disease again. The big question is how much protection?
If you catch a bad cold and then catch COVID-19 a few weeks later, will the symptoms be milder?
Great question. Impossible to say at this point. But one explanation for why we're seeing what looks like pre-existing immunity in some people might be down to protein structures in SARS-CoV-2 that it shares in common with coronaviruses that cause colds. And whether or not they can help at least some immune systems recognize COVID-19 and get a head start on fighting it off. Although we're still trying to pin down exactly what role T cells might play in immunity, a recent very small-scale study looking at the dynamics of immune response, notice something very interesting. In the control group of unexposed test subjects, 2 in 10 people actually responded to SARS-CoV-2 proteins. That's an indicator that there could indeed be at least some weak overlap in terms of immune response if you've recently had a cold and then get COVID-19. But that's still a really big maybe.
Now, before we go, we want to end this week with a look at where the world stands in the fight against the pandemic. Now, data from 209 countries and territories tell us that more than half of those countries worldwide are reporting more COVID-19 cases than they did just last week. And while less than a third were able to claim their infection rates were falling, 15 had no infections at all. Taking a look at the numbers week by week, we can see that the number of countries free from the coronavirus, shown here in blue, continues to be on the retreat, meaning the virus keeps spreading.